There we go. Perfect, Tony.
Okay, good morning, everybody. As Michael said, thank you very much for logging on this morning in these exceptional times. We're using exceptional methods to try and get our message across to everybody. So yes, hopefully this will be of some interest to you. Just to say before we start that the definitive source of information is always on our website. Clearly, we can update that as and when we need to. So I'll be running through slides today, maybe a group of 8 or 9 courses, and hopefully the information that'll be on there will be of some use to you. I'll give you some introductory information as well. So, okay, we'll start off then with the first slide. If Michael can just advance that one.
Sorry, Tony, it just seems you're frozen there. Just gives 1 wee sec just to...
Yes, okay.
That's us. Sorry, buddy.
That's it. Not a problem. Okay. So we're going to look today at courses and careers in the allied health professions. So as I say, there's a group of about 8 or 9 courses there. And in terms of the general presentation, what I want to do today is give you a brief introduction to the allied health professions. So just the next slide there, Michael. And the summary of the degree courses. Now, we're not going into a whole load of information, say, in terms of that. It's headline information that will be presented on the slides, and I'll let you gather the information yourself. I have some additional stuff I'll throw in as we go through each of the courses. So, again, I'd like to give you examples of the kind of career opportunities. Those will be listed on the slides. So, again, I'll leave you to read those. I'll try and give you some additional information in terms of the content of the courses, because that's, again, gives you knowledge about what you would actually study on a day-to-day basis. And again, one of the probably the sore points almost with a lot of these courses is the health professions admissions test, the dreaded HPAT. It's been about 11, 12, 13 years now. Most schools and colleges are more than aware of it now, and it's really not as horrendous as people, I think, make it out to be. But it is certainly the first stage in a 2-stage admissions process for most of these courses. But we'll come to that as we go along. In terms of those courses that we're looking at today, they represent pathways to a very diverse range of careers out there, normally in the National Health Service, mostly in the National Health Service, but not exclusively. They contribute, as you can see there, 20% of the workforce in Northern Ireland. And again, in terms of the general context that you'd be working within, you're providing those, as it says, diagnostic, technical, therapeutic support areas that are critical to the National Health Service. And on the point of it being critical, it does mean, on the positive side, that for a number of these courses, most of these courses, the tuition fees are paid for you effectively, because they are regarded as professions that are so crucial to the National Health Service that basically the National Health Service can't risk the supply of qualified professionals coming through drying up. They can't do that. So they are effectively sponsor the fees. And all of the courses are regulated by the Health and Care Professions Council. And that's an important thing if you are going on to work in this area. You've got to, you'll be wanting to be regulated, you want to be registered with them. And all our courses do give you that registration. And that's an important thing to bear in mind wherever you're studying, not just Ulster University. Okay. Moving on. To give you an idea of what we offer in a general sense, the staff that will be lecturing to you, the teaching staff, are all professionally registered. They've all had experience out and about there in the National Health Service or wherever, and they're all professionally registered with the Health and Care Professions Council. The teaching, the content of your course is all very much research focused. Like, people sometimes ask, well, you know, what has research got to do with me going in and getting my lecture on a Monday morning? Well, the bottom line is a lot of the research in these areas by the university is internationally recognized. And that means that that information, that cutting edge information, is filtering back down to your course, and that's what you're getting taught. And the greater a university's reputation in terms of research, the more it attracts top academic lecturers. So the whole quality of what you're getting is raised in terms of that research profile. So it is an important thing. The programs we offer are ranging from Bachelor of Science, which is what you would be starting on, right through some of the top postgraduate master's courses, right through to your doctorates, PhD. Placements and so on in Northern Ireland, further afield. And again, once you graduate at the end of your course, you will be eligible to register with the Health and Care Professions Council. And that's an important aspect. And you'll be eligible to work not just in Northern Ireland, but beyond, outside of Northern Ireland. You may have to do a very minor sort of conversion course if you're going to another country, but it's a very minor thing. Okay, so what other things do you have to consider whenever you're going to study at Ulster? Well, as I've already mentioned, if you've been resident in Northern Ireland for 3 years, you will get your fees paid, basically. Now, the fees are paid directly to the university by the DHSSPS, but what it means to you or to your parents probably is that you won't have to pay tuition fees for the duration of the course. You'll also need to have completed an access NI check. That's just a standard police social security check. Make sure you're kosher and no issues that might make you a risk in terms of working with children or vulnerable adults. That's a standard thing. You'll also need the medical, and you will also, as I've said, need to, for most of these courses, have to have sat the university's HPAT test and have acquired that sufficient level to then be made the standard A-level offer. And again, always check in case there's any GCSE requirements. For example, again, all of these courses will need GCSE maths, but pretty well every school will make sure you leave with your GCSE English maths. That's pretty standard issue. Once you get to university, what sort of thing can you expect? How is it different to school? Well, it is different to school, and you'd want it to be different to school. Most people are ready for a bit of a change after they've spent whatever 7 years at school or FE college. It's 9 to 5, Monday to Friday. These are fairly intensive courses. They're very vocational courses. And again, I'll come back to that when we're talking about HPAT. So vocational, by vocational, I mean you really need to want to do them. So it's not like you would be doing, you just throw a physiotherapy application in along with a load of just general courses. People who want to do these courses are committed to doing them. And that has to be evident in terms of your application. You will get clinical placement experiences as you would expect. You need to know what you're doing out and about there. It's not just the academic lecture content, although lectures, as you see, are part of it. And there's practical classes, again, working with instrumentation and so on to improve your proficiency. And the staff are always very committed, enthusiastic, supportive staff. That's something we in the university pride ourselves in. This is something that Ulster University has got a reputation for. I've mentioned before, you get a registration with the HCPC when you finish. And the employment statistics are very good indeed, as you would expect. And just to mention a point again, which will come up later, we have to wait until we're told by the DHSSPS each year how many places we have available in each of these, like how many, maybe 50 or 60 for physiotherapy, before we can finalize offers to you. That is an indication of the confidence they have in employment at the end of the day. So those figures that they give us are based on projected need 3 years down the line. So that's as near as you can get to a guarantee of employment within at least the National Health Service. There's no such thing as a full guarantee, but that's as near as you can get. Okay. Now, at Ulster, we offer degrees in this area, in those following areas there. And again, I'm not going to just read all down the slide. I'll let you have a look at those yourself there. In terms of the first one there, dietetics, and it to some extent is a bit of an exception because it's at Coleraine. Now, that raises the issue of campus, which I'll come to in the next slide. This will be staying at Coleraine, again, without just going down through all the information that's on there. Oh, could I go back on that one again, please? Thanks, Michael. You can read there the subjects that are required. I'll not go through those. Just to mention it in terms of what you would study on the course, which isn't information that's on that slide there. It's a very diverse course because you'll be going through, and I'm going to read this unashamedly, read this off, areas like chemistry, biochemistry, physiology, biology, immunology, genetics, pharmacology, pathology, food science, epidemiology, statistics, psychology, communication, and management. So maybe more there than you thought you would be getting in dietetics, but clearly anybody doing that course will want to become a state registered dietitian, and you'll see the career opportunities at the bottom, either within the National Health Service or in private practice as well. An excellent course that's been running for a long time at Coleraine. Okay, first of the Jordanstown ones, occupational therapy. You'll see under the campus location it is under review. Now, the courses that are currently based and have been based at Jordanstown for a considerable number of years will be moving, but where they're going is all up for review. There's a public consultation that had been launched but is now paused because of the coronavirus. So that will have been extended because we're very keen to make sure that the final decision is reflective of public concern and so on. So that is out for review at the minute. So I cannot give you a clear answer on where that course will be moving to. But schools and colleges will be for sure told once that decision is made. Again, that's an interesting one there. Any subjects at all, and you'll see the career opportunities. Occupational therapists, they work with all age groups, helping them to carry out activities that they maybe can't do because of physical illness, mental illness, disability, growing older, and so on. And it combines obviously academic study along with practice placement as well. Our next course is physiotherapy. Again, very similar, almost identical entrance requirements to see from that. It is also under review in terms of where that course will be moving to. And again, those grades you'll see there, 3Bs, can I just say those are expressed in A-level terms. If any of you are doing anything other than A-levels, we obviously look at equivalent qualifications, whether that be BTEC qualifications, applied A-levels, or if anybody's logged in from the Republic of Ireland, leaving cert as well. So that's just indicative there. And again, you'll get equivalences on our website. Physiotherapists, again, work with all age groups and basically maximizing somebody's ability to move and function. So you're going to be looking at areas of health, community care, mental health as well, management, neurological rehabilitation, a wide range of things there that will prepare you for work in the outside world. I'm just been attacked by the family dog on the kitchen door here, so my apologies if you hear scratching noises. Okay, moving on to the next course there, and it's podiatry. So again, you'll see similar set of requirements, entry requirements. Again, people who are going into podiatrists, it's to do with the promotion, maintenance, restoration of foot health generally. So you would be assessing, diagnosing problems of the lower limbs and feet and treating these. It includes specialisms, that degree, in things like sports medicine, pediatrics, rheumatology, musculoskeletal issues, and so on. Diabetes even as well, and even things like forensic podiatry as well, where you would be possibly involved in criminal investigations to assist with those. So that always raises a bit of interest, I know as well. So again, podiatry is one of those courses that will be moving from Jordanstown. We're not sure to where just yet. Okay, moving on to diagnostic radiography and imaging. And this again, you're looking at these kind of graduates in this area will be moving into areas where they're doing imaging examinations to diagnose, to treat, to monitor disease and injury, including screening of healthy individuals as well. Now, they'll use things like obviously X-rays, CT scanning, and MRI, and so on, usually in a National Health Service context, but not exclusively, again, as you'll see at the bottom of the screen there. So that is a critically important one. Again, it's been in the news with the coronavirus and the concern that people are not being referred for this kind of treatment at the moment because of their fear of perhaps contracting coronavirus in the hospitals. And indeed, I think in many cases, they don't want to add burden to the National Health Service at the moment. So it's a serious concern, but a vital area, as is the next one, which is radiotherapy and oncology. Similar set of requirements again. Again, the location is under review. People coming off this degree will be going into fairly obviously into becoming a therapeutic radiography or a radiation therapist. Normally in the National Health Service, it involves the use of ionizing radiation in the treatment of cancer. So they're responsible for treating and indeed the general health care of the patient. So very much connection with the previous diagnostic radiography as well. They work very much together. Okay, in terms of speech and language therapy, similar again at Jordanstown, but will be moving. And again, the grades are just indicative. Any subjects are considered there for speech and language therapy. That is a slight change from what would have been the case in previous years there. There would have been subject requirements, but any subjects are considered for entry to speech and language therapists. And you'll see the career opportunities down at the bottom there. Again, a speech therapist will be working, I suppose, with all kinds of communication disorders, people who maybe had strokes, people with learning disorders, and so on. And again, practical placements are very much a part of that course at the university. Okay, moving on to health physiology now, and the last of the slides to do with courses anyhow. Again, based at Georgetown, just to point out the grades, one grade lower, 2B and a C. This is one of the courses along with podiatry, and I should have mentioned that as we were passing podiatry, that do not need the HPAT test. So podiatry and this one here do not need the HPAT test. All the others that we've looked at do, okay? We'll see a list of these in the last section, which is to do with the HPAT test itself. There's a common first year here. You'll wonder what the slash is between the two here, health physiology and healthcare science. Common first year there, and at the end of year one, if you're on health physiology, you have the option, if you've completed that year successfully, to move into healthcare science. And you would finish that degree with specialisms either in cardiology or respiratory and sleep science. Now, if that's you, if you finish in one of those two, you'd be eligible for entry for registration with the Academy of Healthcare Science. Very interesting degree, this as well. So it's a range of cardiac and respiratory topics, really linked between human physiology and the measurement of that. So there's medical science underpinning the whole course and the functions of the human body and so on, and how those functions can be measured is an important aspect of this. So you learn about cardiovascular and respiratory diseases and basically how they can be diagnosed, how they can be monitored using a whole range of technologies. So an interesting course there at Jordanstown, but it will be on the move as well. I think it's fair to say that the move will take place by 2021 entry, which was probably the year most of you who are logged in this morning will be relevant to yourselves. So, but again, out for consultation. That will all be, once the final decision is made, it will be conveyed to you all via your schools and on our website and so on. Okay, in terms of the HPAT test, okay, I want to just give you a little bit about the rationale behind this. It's, first of all, only Ulster University has this. So we are the only university that applies this HPAT-Ulster. Now, technically it is HPAT-Ulster. There is an HPAT Ireland, which is used by some universities in the south for entry to their medical degrees. It has nothing whatsoever to do with us. This one here is only for Ulster courses. Those courses that we have mentioned, with the exception of podiatry and health physiology, as I said. And there's a list of them there. Now, why did we bring this in? Well, basically because in the past, these are popular courses. They're high demand courses. Used to be entry was 3 grade A's at A level or equivalent to A level. That didn't necessarily guarantee that the person had the right mindset or the right attitude for a career spent in some of these professions. So what we wanted was something that would test that mindset, to look for, as you can see here, the caring gene, which of course doesn't actually exist, but you know what we're getting at. We need to have the right vocational stickability, if you like, to get onto these courses. Not just that, but to stay in the professions and work through maybe a lifetime working in these. They're challenging professions, but they're very rewarding professions. You tend to find that with all careers. There's pluses, there's minuses, but you have to want to really do these to get into these areas. Otherwise, they're not for you. So that was the basic rationale behind why they were brought in I think it was about 12 years ago. And there you'll see the courses that they apply to. Just to reinforce that again, the 2 that are missing, podiatry and health physiology. So those are the 6 courses that have got where you have to do the HPAT. Those are 6 courses where the fees are paid along with podiatry. Now, although it doesn't have the HPAT, you do get your fees paid for that. So podiatry in terms of fees, but not in terms of HPAT. So hopefully I've made that clear. Okay, and moving on. In terms of your role as a therapist, once you go through the system, what's important? Well, those communication skills are really important. You've got to be able to relax, make a patient relax so they'll open up and let you see what their symptoms are. You've got to be able to have therapist skills, obviously, once you diagnose the problem, and you've got to have recording skills, because all of this has got to be monitored in terms of providing benchmarks for progress or lack of progress in terms of the disease or the disability. So you can see from that slide that's up there, the patient comes in, you talk to them, you record that information as to regard symptoms. There's a physical examination clearly in terms of their symptoms and diagnosing then what might be the problem. There's a report given to the patient verbally, and treatment recommendations, and then the program of treatment begins and the data is recorded each time there's a visit. So you can see the number of skills that are involved there as a therapist. Those are all important aspects of it. So what about those skills? Excuse me. Okay, moving on to the next one there, you'll see that the first of those, the therapist skills, within that, clearly you need the specialist knowledge. So you need the course content, you need to have the knowledge of physiotherapy and all about the movement of the body and so on, manipulation of limbs. You need of those practical skills, and that's only gained through various clinical placements out and about and within practical sessions in the university. And you need the expertise, which obviously only can come from, you know, doing the job, and that will come as you work through your career. You will have expertise before you leave, but the experience comes in the years, excuse me, in the years following that. You need those people skills, again, to be able to relax people, to get them to open up, to talk to you, to make sure you've got a full comprehensive idea of the problems, and you need those recording skills, as we've said before. So those are important aspects. Okay, let's have a look at the test itself. And again, there's a lot of, I think, fear engendered about the HPAT test. And okay, it's probably a longer test, for example, than any of you will have experienced at school. It's a 3-hour test, but you need to add about an hour to that in terms of registration and so on, various administrative aspects to it. I'm not going to go into the actual what happens on the sort of the test day or whatever. That would all come in due course. The kind of preliminary calendar for this, and it is preliminary as is everything at the moment with coronavirus, is that you can register for the test online from October this year through to early January. The test itself will be late January, normally the last Saturday of the month, but again, all of that's to be confirmed. And it assesses those things that you see on the screen there. Reasoning skills, understanding people, working with people, some of those that we've mentioned about. Okay, now looking at the structure, briefly looking at the structure, again, I don't want to go into too much detail here. There are 3 sections, 3 papers, and you'll see the 3 sections there: critical reasoning, interpersonal understanding, written communication. They're different in their format. The first 2, you'll see the times there, and looks pretty horrendous. I know the first one, they have 45 questions. You'll have multiple choice answers. Lasts for just over an hour. The second one lasts just under an hour, 45 questions, again, multiple choice. And the third one is written communication. You have 2 sections in that, each half an hour, and it's a written paper. Now, just to mention on each of those there as well as we go through, first one, critical reasoning. Different courses will weight different sections differently. What I'm trying to say is that, let's say physiotherapy might say, well, we want critical reasoning. We regard that as more important for this course and for this profession. So in this composite scores, the scores that will make up your overall HPAT score, we will weight that one with more importance. Now, I mention that because sometimes we get queries, could be two classmates who have applied for the same course and who ended up getting the same HPAT overall score, and one gets an offer and the other doesn't. Now, that could be because the section in the HPAT that physiotherapy has weighted as more important, you scored better than your classmate, just that section within it. Now, your overall scores might be the same, but you came out better in the section that is considered more important for that course. So just by way of explaining that. You'll see there the content, general interest in social sciences, science. You'll get little diagrams, text. You'll be asked to interpret these, solve little problems, analyze data, and so on. Again, I'll not go into all the text that's on the screen there. The second section is interpersonal understanding. And again, as I say, I apologize if I'm flying through these or appearing to be flying through them, but these are really in the body of the test itself. And I think it's slightly early days just to be concerning you unduly with that. Interpersonal understanding, again, is narrative situations. For example, there was one year where there was a scenario presented where a man came back to a car park. His wing mirror of his car was hanging off, and 2 young lads were walking over. And people were asked to interpret that situation. Some will interpret as the 2 lads are coming over to help the man or see if they can help him. Others would interpret that as these 2 guys were more of a threat. They were coming over to knock his other wing mirror off, perhaps. But different people interpret situations in different ways. And that's important to us. And that tells us something about you as well. So things like that. And again, it raises the whole issue of, well, can you revise for this? I'll mention that in the next slide, or the one after the next. Interpersonal understanding. I think we've gone the wrong way there, Michael. No, we haven't. I've gone the wrong way here. My apologies, Michael, sorry. Written communication, again, 2 sections in the final paper. And again, for example, in section A, you might be given a graph of, or a number of graphs, could be something to do with crime rate, recorded crime in the UK, and you're just asked to make a commentary on that, interpret it. It would be something to do with, like social issues like perhaps crime or whatever. The second, section B, would be much more blue sky. You would be given perhaps something like a quotation from somebody. It could be an historical quotation. It could be a modern quotation. It might be something else, just a statement. And basically you're told to write, what do you make of that, in half an hour? Okay, moving on to, on to the next one, which is, that's us. The HPAT itself, just have a look at the calendar for that now in the closing stages here, because I want to leave a bit of time. You do the test in, let's say, late January. The papers are sent off for marking, and it is the Australian Council for Educational Research that mark, moderate, set this examination. So there's no connection with the university. It's not an internal thing that we do. Those scores come back. They're listed in ranked order, course by course, and again taking into account that weighting that I was mentioning about earlier on. Now, worth mentioning here, you will experience a delay before anything happens, because we then have to wait for the DHSSPS to tell us how many places they're going to commission. In other words, how many places in physiotherapy, speech therapy, whatever, podiatry, we can take in that year and that they're prepared to fund. And that may not happen until, you know, coming into sort of late March, April time. So there may be a gap from when you do the test. That is why, so don't panic. I mean, ring us if you want reassurance, but there's normally a gap there, and that's because we're waiting to find how many places we can actually offer. And once we do, we will then process those offers through UCAS, and in most cases, the offer will be 3 grade Bs, as you saw from the previous slides. You can find more information now on the next slide in terms of the details of it on that website, which is, hopefully you just see that website at the bottom, HPAT-Ulster.org. Things like when to register, how you register, how much it costs, preparing for the test, where you do it, and so on, guidance in the test day and whatever. Now, there are organizations out there that offer so-called coaching courses, and I believe there's something like £150. Important to say, we don't endorse any of those. That's entirely your decision. It's a lot of money. It's up to you, but the test itself is in excess of £100. So it starts to all add up. Your test score, incidentally, if you don't get in 1 year, will hold over for a second year, just to mention that. So in terms of preparation, there are examples of questions on that website. You can also buy a half-sized test for something like £15 or in the teens of pounds. And I think that's probably worthwhile doing, because at least it familiarizes you visually with the layout of the test, and you don't have that shock horror when you come in on that Saturday morning and open everything up and think, I've never seen anything like this before, you know, what do I do? So I'm going to stop there and leave a bit of time. I'm not sure, Michael, if you want to take it from there or what way you want to just finish off there. But thank you all very much for your interest and logging on this morning. I hope you keep safe. I hope you decide to choose Ulster, obviously one of our health profession courses. And, you know, we'll look forward to seeing you, hopefully, as things start to return to normality. You know, this year, probably more likely next year, if you're all like in year 13. Anyway, thanks. Over to you, Michael.
Hey, Tony, thanks very much for that. It was super. So just generally, I'll just try to cover a few things here for the last wee section. Just a couple of things I'll just go over before I hit the question and answers. But first one is that there are more webinars coming up. So that's for the next couple of weeks and probably into June. So do keep an eye on the website. You'll get all the information on there. There's a nursing one. There's a personalised medicine one that's this week. There's loads of subject areas ones, geography and business, and across a whole range, engineering, computing, across a whole range of subjects that the university offers. So do keep an eye on that, and then you will be able to register for those. We've also open days coming up. So at the minute, it's for your schools to register. So again, your school hopefully will be on there, and they'll register to attend on a certain day. So they're taking place throughout September, hopefully, if we're all back. And then around May time, or June, then we'd ask for you guys. So individually, you will then register to attend a certain open day, and then there'll be talks on those days as well. So do keep an eye out for that. That'll be on our website very soon. So just to go through, I was answering some of the questions there just online, typing them, but I'll be able to answer now. So somebody's asked, Lisa has asked her, if I've already done the HPAT, will I have to do it again? So if you've passed it, Lisa, then you can use it then and keep it for 2 years. But after 2 years, then you need to reset the HPAT test. So if you've got it and you're planning on taking a gap year or for 2 years, then that's absolutely fine. But then need to reset it if you didn't pass it this time, you need to reset it. If you did get it, then it's usable then for 2 years.
Michael, can I jump in quickly there?
Yeah.
Yeah, just to add to that, that's absolutely right. Just to add there that the threshold for what constitutes success could be different for the same course from 1 year to the next. So, you mightn't, where your score mightn't have got you in this year, it might be sufficient to get you in next year, but there's no guarantee of that. They can fluctuate, and to some extent that reflects the numbers of people applying. But just to mention that there's a variable sort of notional pass rates really based on a percentile kind of calculation.
Okay. So tell us a bit about lengths of placements each year. Tony, are you able to come in there about the length of placements?
Lengths of placements?
Yeah, in terms of, a couple of months or how long they'd be on placement?
Sure. Well, for something like physiotherapy, you would be doing at least 1,000 hours, which sounds amazing, of supervised clinical practice. Now that would be in, I think it's 5 different 6-week placements in Northern Ireland, like hospitals or community settings or private practice schools even. Some others will have different lengths of placement, but it's normally blocks of placement where you would be out in those kind of environments where you would end up working whenever you graduate. And that's combined with I think I mentioned it, practical experience in classroom laboratory situations where because they do have mock-ups in terms of some of the equipment and so on, so it's the practical element isn't all out there. Some of it will be, for example, instrumentation and so on. Some of the equipment you would have experienced familiarity with in the university, but then would be using it in the real life context. So these are, because of the nature of these courses, clinical placements are built into all of them, but they're normally integral as you go along in pretty well every year of the course. So you don't go out, for example, as in some of our other courses in other subject areas where you do your 3rd year completely out in the placement and come back in. So years 1, 2, academic, year 3, out in placement, year 4, academic. It's not like that. They're all kind of integrated through it. I don't know if that answers.
Okay, Tony. George just asked, in the health physiology course, did you mention, Tony, in the 2nd year you specialise in 1 or 2 different areas?
Yeah, you have that.
What those areas are?
Well, if you transfer across from health physiology to healthcare science, you go down one of 2 streams. One of them is cardiology. So that would be, obviously do with the heart and circulation and the measurement of and monitoring of circulation and heart issues. And the other branch is respiratory and sleep science. So again, they are connected clearly, but there's a division there. You can go down one or other of those. So that's 2 of them. One is cardiology. The second is respiratory and sleep science. And if you do that second one, you'd be eligible for registration, I think, as I said, with the Academy of Healthcare Science. So those are the 2 main ones. Okay,
super, Tony. Thanks for that. So somebody's just asked when's the nursing webinar. So that is on Thursday the 14th. Okay, so next week. So you'll be able to register on our website. On the homepage, you'll see a link for future webinars and future applicant webinars. You click on that. And that will take you through then to a full list of the webinars, and then you'll be able to register onto that and that will be solely specifically for nursing. Okay. Somebody's then asked, can we reset the HPAT? Yes, you can. So if you've sat it, try and get on the course for this September. if you don't get it, basically, you need it for all those 6 courses, so you'll not get on no matter what happens with your results. It's not related to your results in any way in terms of if you get over and above the 3 Bs or anything like that. You need to get the HPAT. So if you don't achieve the result, then you'll have to reset it the following year if you want to get on to do a particular course. All right. And then somebody asked you so many cases were there for OT. So from memory, for last year's intake, there was around 50 from memory for OT. So that's just what I was explaining earlier, just about students sometimes getting an offer. If you apply to the university to do, say, the likes of OT, and then you also apply to do podiatry, you could, in essence, get your HPAT for OT, but you don't get it for podiatry, because podiatry, there could only be 19 places, funded places available, but for OT there's 50. So that way then the pass rate then would be higher, or the success rate to get onto the course would be higher for podiatry, because there's only 19 places as opposed to OT where there's 50 places. So that's what Tony was just explaining, that you can, as I say, get an offer to get on to one particular course within it, and then you mightn't get an offer for another. So the factors are that it depends on how many people are sitting the HPAT relevant to that course, and then how many places are available on that course also. All right, so hopefully that has answered that one for you. Is it a traditional university teaching year, unlike nursing where placements would be in the summer and university year is longer? So it is, isn't it, Tony?
What? Sorry, I don't quite understand
So
that.
they're just asking, if you do nursing, you're in during the summer, your placement and stuff would be in during the summer.
Oh, yeah, sorry, yes.
Just your 3 semesters, and that's really it.
Yeah, it's a more traditional academic year with these courses here. Nursing is, it's a different one. It's pretty well, it's a 48-week year, I think, as far as I remember.
Yeah. So it's just for those ones there that we mentioned today, your placement will be built in as part of your course. So there would be opportunities to do stuff during the summer. There could be, additional things you could be doing. Maybe you got an extra placement that you wanted to take part in, that would maybe help you as part of your studies, but that you wouldn't necessarily have to do that. That could just be an opportunity that arises as part of your studies at university. But unlike nursing, where you would generally be in over the summer months. So a student has just asked, what skills qualities would be key to have on a UCAS application for speech and language? So that's a wee bit that your personal statement is important on your UCAS form, but essentially for the likes of the courses that we discussed today, especially the ones that are all HPAT, your personal statement won't have any relevance unless you pass the HPAT test. Okay, so if no matter what you say on your personal statement that you have been in X amount of placements, you have been involved in speech and language, and it's where you want to be, and it's your passion, and you've done placements in various therapies and stuff, that'll all be irrelevant if you don't pass and get the score for the HPAT test. Okay, so basically you have to get your HPAT score to get your offer, and then that'll be on to the course. So as long as you achieve your grades then come that August time. So it's not necessarily all your skills and qualities could be transferable skills, so they can be used across a broad range of courses. So if you are applying for different things, you can be saying about your time management, your commitment, your dedication, why you pick certain subjects, what empathy you have, why you want to get involved in that particular area of study, why you want to go into that as your career. So that's all just general stuff that you can put on your personal statement, but the university won't be reading that personal statement to get you on to do the course. It'll be your HPAT score, and then as long as you're on target for achieving the 3 Bs, then you'll get your offer to get on to do the course. Okay, so hopefully that's answered that. How many spaces are on dietetics? So last year there was 21 available on dietetics. So again, a very competitive, as opposed to likes of physiotherapy where there's 55. So for dietetics, there were 21. So again, the pass rate for dietetics is going to be higher than what it is for some of the others, the likes of physio, where there's 55 places. Okay, but the numbers that set the HPAT that want to do dietetics will be lower. And that's generally because Tony was highlighting where you're needing 2 sciences. So not every student is going in and doing 2 sciences. So if you have that, and then so the numbers that actually apply for the HPAT relevant to dietetics would be lower. But you also have lower places that are available, fewer places that are available. All right, so hopefully that's answered that one for you. So somebody's just asked, what's the pass mark for HPAT? So just again to that, there's no pass mark. Okay, the pass mark, if you apply to do physiotherapy and you apply to do dietetics, as I just made the example there, the pass mark for both will be different. So you or a friend of yours could sit it and they get on to do physiotherapy, or you get an offer to do your physiotherapy, but you don't get it for dietetics. And that's because the pass mark is relevant to the number of people that are sitting the test and then the number of places that are available on the course. Okay, so hopefully that has answered that for you. If it hasn't, please come back to me and I'll try and explain it. What would be the main point the admissions team look for in a physiotherapy personal statement? So again, Tony, if you're happy, I'll just cover this one.
Yeah.
Just again, your personal statement for all these courses, all these 6 that are HPAT courses, your personal statement won't have that big an impact for you. You does need to stress about your dedication, your commitment, your empathy, why you want to work in this area. Because obviously you need those skills that the HPAT test is trying to get, your interpersonal skills, your written communication skills, your verbal reasoning, how you relate to people, how you communicate with people, how you build rapport with people. That's all important for you. But no matter what you say in your personal statement, as I say, if you have loads of prior work experience, you've been in a physiotherapist from you were 15 or 16, or you know somebody who's a physiotherapist and they've let you go in and work with them, that'll have no impact for you unless you pass your HPAT and you get that score that's required for you to go on to do that course. Okay, so yes, your personal statement has to be grammatically correct, it has to be laid out, it has to be done right, and it has to sell yourself as an individual, because your personal statement is used across all the courses that you apply for. So all 5 courses, if you apply for up to 5 courses, that same personal statement is relevant for all those 5 courses. So you need to do it right, but it'll have no real bearing on you getting on to do those courses unless you pass and get the score for your HPAT. All right. How many placements are there for diagnostic radiography? So everybody would get a placement that's on the course, wouldn't they, Tony?
Yes, I think it's an integral part of the course there. I'm not sure how many exactly within the course, but the placements are integral to all of these because of the practical applied nature of the professions. Yeah. So if you're asking placements for the course, then you're more likely you will get a placement, because everybody, that's the main reason for it being bursary funded. The Department of Health is projecting to say, right, well, we're going to fund 23 radiographers. So therefore, they know in 3 years' time when the course is complete that they need 23 radiographers. So that's why they're funding those places. So therefore, they will have placements available for you, because you're on a list that, they know how many students they need to go into radiography. So you're more likely you definitely will get a placement. In terms of the number of applicants, what are the most popular courses? So out of that list that Tony gave there, OT and physiotherapy would have around 55 places available on them, but they will also have the most applicants. So out of everybody that applies on those 6 courses, they all sit the one HPAT test, but you could have probably out of that list of everybody that sits it, about, from memory, around 360 odd would be applying, for example, to do physiotherapy.
So out of those 360, then there's 55 will get made an offer, and they're just ranked 1 to 55. So the top 55 that achieve the score would then get on to do that course. Whereas the likes of, say, the example I was given earlier, podiatry or dietetics, for example, where there's 21, but you might maybe only get 150 students out of the whole number that have sat that test, want to do it for the dietetics course, but there's only 19 places available or 21 places available. Okay, so everybody sits the one HPAT, and as I say, the most popular ones would be OT and physiotherapy, where they both have around 360 or thereabouts students who have applied to do that particular course and are doing the HPAT to try and get on to do OT or physiotherapy. Okay, so potential number of places for speech therapy. So again, from memory, last year it varied between 21 and 23. Now, with all this going on, there's talk that the Department of Health is getting more funding and there's going to be more places, but as yet we haven't been able to verify that. So the places that are available have varied around that. They've been in the 20s, but they've been between 20 and 23 for the likes of speech therapy. Okay. How many modules are there in the first year of physiotherapy? Sure, but you will get that on the website. If you search for physiotherapy on our website, down the left-hand side, you'll see an overview. You'll see the entry conditions, but you'll also get modules, and it'll be the course breakdown. So you'll see the modules you'll do in first year, second year, and final year. So it'll give you the whole module breakdown. So as I say, go to the website, ulster.ac.uk, search for physiotherapy, click into it, and then you'll see a course overview, and then you'll see a module breakdown, and it'll give you an idea of all the modules that you'll study.
I think they're, Michael, sorry to cut in on you. Yeah. I mean, I think they're still basically conformed to the basic 6 modules per year. For most courses, it can be a bit of variation. You can get half modules and so on, but it's around the half dozen, and they'll be mostly, for courses like that, compulsory modules. I know in some other areas you can have optional modules, but it's a fairly well constrained course. You've got to do pretty well everything as a compulsory module, but I think it's around about 6. But good advice to check on the website there to get the breakdown.
Yeah, it will give you a breakdown. Lisa's just asked, will the campus for health science be moving from Jordanstown in the future? So I can answer that. Just one is yes, it definitely will. Jordanstown will be closing, so that's the easy bit of that. They'll definitely be moving, but where to is the other side of that we can't answer. As Tony was just saying earlier, the likes of dietetics, which is delivered up at Coleraine, but the majority of all those other ones are in Jordanstown, and we're unsure of where they're going. So there was what was that, Tony? That
there's a consultation.
Sorry, that's the word. Yep. Mm-hmm. So there was a consultation went out to a whole range of stakeholders asking for their opinion on where those courses should be moved to, and then it was going to then evaluate all that information and then decide on where they were going. But as Tony was saying, because of everything that's happened, that consultation has been put on hold. So for us going out and chatting to students and chatting to you guys now, unfortunately, we're not able to answer that question. But it definitely will be moving from Jordanstown, because Jordanstown will be closing the year after next. All right. How many spaces are there for radiography? So again, from memory, it's in the 20s. So it's around 23, 25, something like that. There'll be no more than that available for radiography. Okay. So hopefully I've answered that for you. Do many go into sports physio from course? So I'll assume that's the physio course, and then would people go into sports physio? So yeah, that would be a natural progression. For a lot of students, they would go in that area and specialise in sports physiotherapy. And we would do a master's in those kind of areas as well. So after you would graduate with your degree, then you could maybe potentially at the university then go on to do a master's in maybe a relevant area like that, sport and exercise science and different things as well. So yeah, wouldn't that right, Tony? That would be a good physio, yeah.
Yes, it's quite a common. It's one of the common destinations. Sometimes people are asking, do you go at that through the sports degree, or do you go at it through the physiotherapy degree? And it depends to some extent what you want to end up. Do you want to be a physiotherapist? Well, then physiotherapy with a sports specialism.
Yeah.
But sports covered within the degree. It's one of the things it's looked at. Biomechanics, physiology, science of movement, all of those kind of things are part and parcel of a physiotherapy degree anyhow.
Yeah. And then somebody's just asked, what career areas are the most in demand by the Health Trust for job opportunities currently? So, Ian, I can just cover that the way that because these are funded through the Department of Health, they are basically saying that in 3 years' time, if they're going to fund now 50 physiotherapists, they're saying in 3 years' time that's what's needed for the Health Trust. And the same for radiographers, speech and language therapists, podiatrists, whatever numbers they give the university now to fund, they're predicting in 3 years' time that's how many they're going to need. So that allows you to, that's why Tony was able to say there's nearly, we can't guarantee 100% success in terms of your job, but there nearly is, because the health trust, these are funded by the health trust, and then they're saying in 3 years' time they need this amount of students, and then when you graduate, then you then hopefully would go into, for example, the National Health Service. So those ones that are most in demand, occupational therapists, physiotherapists, where there's usually around 55 places each year, down then through to radiography, dietitians, where there's been around 19, 23 sort of places each year. So again, in the 3 years of your course, then they're basically saying by that time that's how many are going to be needed. So that gives you an idea of the demand. But as you're saying there in the Health Trust, as Tony was elaborating on, there's lots of different things you can be doing as well. Lots of people go into self-employment, go in and set up their own practice. If it was physiotherapy, for example, or going into sports injuries and things like that. So lots of different areas you can go into and go in yourself. You don't necessarily need to go into the Health Trust, but lots of students obviously do. Because of their natural progression into that area. Is physio a really competitive course? And if so, how can I stand out? So again, that's just back to your personal statement. You'll not really get the opportunity to stand out, unfortunately. It's based on your HPAT score. So it is really competitive. As I said earlier, there's around, out of everybody HPAT test, around 360 of them would set it for physio, and then there's usually around 55 places. Okay, so it'd be one of the out of all those 6 that Tony was chatting about relevant to HPAT, it's the most competitive. But you need to get your score. It'll not matter what you say in your personal statement about working in a physio, doing a placement there, been involved in it, you work Saturdays, all that sort of stuff. It's about your skills and attributes and qualities. Yes, you can put those on your personal statement, that you have the empathy, you can relate to people, you can build rapport with people, you can relate to people of all different ages. That's all perfect stuff that you can put on your personal statement. And if you have a placement, that's brilliant, that's as well. But it'll have no impact unless you get your HPAT score. Okay, so as I say, they'll not be reading your personal statement saying, this person's a perfect candidate for this, give them an offer for the course. Your offer is based on your you achieving your HPAT score. Okay. Well, I have an interview for physio. So no, you don't. And there's no interviews for the courses that Tony mentioned today. And especially the ones that are HPAT, there's none of those courses have an interview. You just need to apply, be predicted, and be studying the right subjects, obviously, that then the university then, and then you are doing the right sciences at A level if needed, and then you apply to do your HPAT test. If you get the score and you get your offer, then if you achieve your grades that August, then that'll be you on to do the course. So there'll be nothing else. There'll be no additional interviews, nothing else you need to get through to get you on to do the course. All right. So hopefully that's answered that one. So I think that's us through them all there, Tony.
Very good.
Nobody else has put anything on there. Is the OT course recognised in EU, Ireland, worldwide?
Yeah, I mean, all of these, I think I mentioned that earlier on there. Okay, there may be some countries where you work, and I don't know, to be fair, the detail, where you might have to do a very minor kind of conversion course, but it's a very minor thing. These are qualifications that would be recognised internationally. I say subject to that caveat where you may have a very minor conversion element to do, but it's a very, very minor thing, if at all.
Yeah. So basically they are, but like everything, you know, even if you were doing nursing or something, if you go to work in Australia, you still need to do some sort of additional reskill in a particular area, because they will obviously be, maybe they focus on other areas more than we do, and we focus on areas more than they do. So that's just a minor transition thing that you maybe just need to do an additional test or something on, but essentially you are a trained occupational therapist, and those skills there could take you anywhere. Okay, so let's answer that one. Okay, guys, so we can stay, hopefully that's answered